The British Medical Association is arguing that government attempts to blame healthcare workers for NHS waiting lists does not have the public convinced.
In a BMA survey published today, almost half of respondents attribute the surge in waiting lists to the government, not to healthcare workers.
Only 15% blame the strikes on waiting lists, which have grown from 2.6 million 12 years ago to nearly 7.7 million this year. But is it really fair to lay all the blame on the government? Well, journalist and political consultant Emma Burnell says the government is to blame for this. And there you've got Harvey Proctor, former Conservative minister, saying the government is not to blame. Harvey, government an easy target on this one, and a lot of people are very happy to put the boot in. How can you defend them?
Well, first of all, I was not a minister, I was just a humble backbencher. How do I defend them? Because the problems that we have now in the National Health Service and in our infrastructure generally is down to labour. Between 1997 and 2010, immigration into this country quadrupled. More than 2.2 million extra people living in this country. Twice the size of Birmingham, to give you an idea of numbers. Now, that has put pressures on the National Health Service and on housing and other matters. We can throw as much money as you want at the National Health Service. There is no limit to the amount of money you can spend. You could spend the entire budget if you so wished, but it wouldn't help.
Well, Emma, what do you want to say to that?
Oh, there are so many things I want to say to that. First of all, there's been a non-Labour government in charge for 13 years. If you really think that Labour is the problem, then, my God, you should have sorted out whatever you think was wrong by now. Secondly, the idea that these people who are coming in, mostly they're coming in because we need them. You know, they are able-bodied, hard-working people who are coming in and actually contributing to our economy. I know that that's an unpopular thing to say, but it is genuinely true that most of the time the people who are coming in are working hard and paying their taxes more than an awful lot of other people.
Harvey, any thoughts on that?
Let me say this. No one, especially me, is blaming the immigrants for coming here. I blame the politicians for letting them in. What we really need to do to get on top of the National Health Service is what the National Health Service has refused to do for 20, 30, 40 years, and that is reform. We need less bureaucrats in the National Health Service, and we need more Indigenous training. That's what's required, probably with a reduction in our population too.
Hey, what do you think of that, Emma?
Again, it's just nasty language. Indigenous training. It just says, you're not welcome here, we won't help you here. It's the people who are non-Indigenous who are actually helping save lives every single day in the NHS. And I think that's really important to recognise.
Michael has got in touch saying the whole care system is broken. Giving doctors more money is necessary, but will not fix a broken system. Dennis says if they want to be called doctors, act like a doctor. I'm sick of waiting for my operation. I'll be blind at this rate. I'll never look at doctors with the same respect again. I thought they were better than this. But Emma, they have a right to strike for money, have they not?
They have an absolute right to strike. They are human beings. We have a sense of how human beings should be treated in the workplace. And that's what striking is about. If they're not being treated the way that they feel they should be treated, they have the right to strike. It's really as simple as that.
I don't, Harvey, I don't really know enough about medical systems in other countries around the world, but Australia seems to be sucking our medics there to work in that country. Canada seems to be doing the same. Is there anybody else's system we need to be copying, looking at more closely? Or is the NHS still the brand that stands up that the rest of the world wants to be?
Well, absolutely not. The National Health Service for decades has been uncriticised, and politicians have refused to criticise it because they thought that it was sacrosanct. Well, it's not. Case after case after case, we have found that we have a second-rate National Health Service, notwithstanding the huge amounts of money that have been put into the National Health Service. So it is time to reform, time to get more Indigenous medical training in this country, and certainly to keep an eye on the numbers of people coming in. Of course, the more people that come in, the more doctors, nurses that you want. And if medical treatment is free, which I don't disagree with, then there is no limit to our demands. Have you got a doctor in your studio? Perhaps you should have, just in case one of you feels ill.
OK,
no
we have to leave it there,
limit to
Emma, unless you really want a final word before we end this.
I mean, we know how we feel about the NHS. Harvey can talk all he wants to, but the public know what they want.
Okay, well, we'll leave it there.
Emma Burnell, Harvey Proctor, thank you both very much indeed.